Well, first, I'd like to say thank you to the Virginia Consumer Healthcare Alliance. My name is John Adams. I'm running for Attorney General, and I appreciate the opportunity to answer a few of your questions today. Well, I'm very cognizant of the fact that I'm running for Attorney General, and while there are many policy concerns in the Commonwealth of Virginia that relate to healthcare, I'm going to focus on what I can do as Attorney General. One of the main problems in the Commonwealth of Virginia where I believe as Attorney General I can have a positive impact is responding to our heroin opioid epidemic. We have up to 4 Virginians a day dying from overdoses, and we're going to, when I'm in the Attorney General's office, put a substance abuse coordination center in place in the Attorney General's office to ensure that we're sharing information throughout the government in Virginia and also with nonprofits, local groups, corporations, faith-based groups to make sure we're all sharing information and getting the best possible results to the best number of people that we can. Well, one of the things that I can do as Attorney General to help reduce healthcare costs is to vigorously enforce our Medicare fraud laws, and I'll do that through our Medicare fraud unit. As a former federal prosecutor, I have the experience it takes and the ability to lead investigations and ensure that they're handled in a thorough and fair way. And as Attorney General, that's probably the most important thing I can do to ensure we have a fair healthcare cost here in Virginia. Well, I'm glad your third question focused on the heroin opioid epidemic. I've already discussed it in an earlier question. So I'll go a little bit further into what our plans are. And we have these plans up on our website. I convened a team that included healthcare professionals, recovery experts, law enforcement folks, and was chaired by the former Chief of Staff of the DEA. One aspect of the plan that I think is important is actually working with our sister states around us. Many parts of Virginia, Southwest Virginia, Northern Virginia in particular, have multiple states that border us. And so while prescription monitoring is effective, it's a well-known problem in certain parts of the state that people are traveling to other states. And one thing that I'm going to investigate is getting compacts with other states so that we share information so that we can more effectively control the flow of these drugs into the community.